Hi. Today we're back again at the Universal Studios, where I get to speak with one of my favorite people in Hollywood, Mario Lopez. We're invited back to talk about ADHD. It's October, and October is ADHD Awareness Month. So we're here to bring awareness to ADHD and hopefully help some people today.
Please welcome back Dr. Simbiat Adighije. How are you, doctor?
I'm good, thank you. I'm so glad to be back, Mario.
It's so nice to have you back. I love seeing your name. It's pretty, Dr. Simbiat Adighije. But you're referred to as Dr. Sim, correct?
Yes.
And to remind people, the founder and CEO of Conscientia Health. It's a mental health practice currently operating in 33 states here in the U.S. and several countries globally. Award-winning, world-renowned psychiatric and mental health expert. Wow, it seems like the world could use you right now. And you've got such a sweet energy about you. I see you being a very successful doctor in this space. So last time you were here, I know we talked about a lot of different months, but October, which happens to be my birthday month.
Me too.
Oh, look at that. Team Libra. Let's go.
Oh, it's same with Scorpio. I used to be Libra, but that's okay.
Okay, that's all right. We're still in October. It's also ADHD Awareness Month.
Yes.
Which is, a lot of people say, I don't know if I've ever been diagnosed, but I'm sure I haven't. So let's dive right in. For our viewers who may not be familiar, how would you define ADHD?
Absolutely, Mario. So ADHD is attention deficit hyperactivity disorder. And so ADHD is characterized by different symptoms, signs and symptoms, which include inattention, hyperactivity, and impulsivity. A lot of people that suffer from ADHD tend to have emotional dysregulation. That's the key there, is to be able to manage our emotions. It can be difficult when you have ADHD.
And what are some signs that you may have that? I know that adults may often go undiagnosed, correct?
Yes, absolutely, exactly. And so when a child has ADHD, oftentimes most people that suffer from ADHD are actually very intelligent and very smart. And so it's hard to kind of, diagnose even as a child because you're doing well at school.
Yeah.
It becomes difficult as an adult when you have to do things that requires a long period of time to pay attention, like readings, deadlines. That's when it becomes a challenge for adults, and that's when they seek treatment. And so for adults, it looks different in everyone. Most of the symptoms would include, again, difficulty paying attention, being disorganized.
Got it. Now, you mentioned treatment. What are various treatment options, and does it have to be some sort of pill oftentimes?
Very good question, Mario. So no, there's several treatment options for ADHD. Cognitive behavioral therapy, where we actually learn actionable items or things or strategies that can help us cope with ADHD is there. You could do mindfulness, really helps. Sleep is very underrated in the US. But
I'm gonna say that it's so underrated. Well, I'm hearing that a lot from doctors these days, right?
Yes, so we have to sleep well. The ADHD brain requires rest, right? Because it's hyperactive.
Yeah.
And so when you sleep better, it's easier for you to manage. And then there's medication, of course, like you mentioned. There's stimulants and non-stimulants. So a lot of people fear, the use of stimulants. And so if you don't want to, there are other options like non-stimulants that you can use to treat ADHD.
Got it. And the other stimulants, is that where the Ritalin comes from?
Exactly.
Or the Adderall, is that what it's for?
Yes, so Ritalin, Adderall, the Vyvanse, the Concertas, those are stimulants. But there are also non-stimulant medications that can really help. Like, I don't want to mention those, but contact your healthcare provider if you're,
Got it.
If you feel like you have ADHD, so they can manage and uniquely for you.
And what advice would you give to someone who suspects they may have it, but maybe is a little reluctant to seek help?
Sure. So knowledge is power. We have to remember that our mental health is just as important as our physical health. First thing you want to do is educate yourself about ADHD. Google, right? With Dr. Google. And so you can educate yourself. The more you know, the easier it is for you to be able to say, do I want to get checked? I don't recommend self-diagnosing. I think that everyone should, if you feel like you have ADHD, seek professional help so you can get some clarity and you can even get tested for it.
And like you said, it's usually hand in hand with someone who is bright. So if you're able to channel that energy, you can be a successful individual if you sort of harness that, right?
Absolutely. In fact, studies have shown that individuals who suffer from ADHD are extremely creative and extremely good at problem solving. So, yeah.
Oh,
the smart ones.
See, I'm feeling much better about myself. What about social support from like family, friends? Could that be difficult for them to deal with sometimes, right?
Yes. So support is very crucial. Now, let's remember that ADHD, for it to be, classified as ADHD or diagnosed that way, typically should affect 2 areas of your life. So it could be work, school, or relationships. Now, I bring up relationships because an ADHD brain really loves you, but can forget your birthday. And so then it becomes a bummer.
So that's why they might forget. I'm like, it's a medical condition. What do you want to do? I'm blaming.
So what we do is we set reminders. We set annual reminders. That's the thing. Digital calendars with alerts or alarms. That's a big one when it comes to ADHD. Writing to-do lists. An adult with ADHD, you almost can't survive without writing a to-do list.
I love a to-do list.
Yes.
See, I love a to-do list.
Yes.
I tend to be free, and I have to write stuff down. I like this. This is really good stuff. Before we wrap up this subject, do you have any final thoughts for our listeners about living with ADHD?
Yes. So living with ADHD is not a deficit in intelligence or your capabilities in doing things. Absolutely not. In fact, you have special powers. Your brain just processes things differently. And so you want to channel that strength, find coping strategies that work for you. Everyone is different. Time management is a big one. And again, seek professional help if you feel like you have ADHD, so you can get tested and you can get treated for it. And at Conscientia Health, that's what we do. We literally specialize in ADHD, all of the disorders.
Well, that's what I was just going to say. Can you tell us about any upcoming projects or initiatives you're working on?
Yeah, so excited. So at Conscientia right now, we're launching a brand new online platform that we're going to incorporate webinars and educational materials for people who want to know more or curious about any mental disorders. And then we're going to have an interactive part of the website coming soon. Very excited about it.
Look at that.
Yeah.
You're firing it up on all cylinders right there. Well, I really appreciate you joining us today and shedding light on this topic, which is important. And happy ADHD Awareness Month to you and again, all our listeners. Always enjoy having you come visit us. So whatever the next mental issue is for the month, you have to come back and visit.
It's very lovely to be here again. Mario, thank you for having me again. And then, happy ADHD Awareness Month.